We're going to explain a little bit about what our investigation was, how we did our investigation, what our conclusions were, and we actually have some future study things there, quite a few of them, because this is a finite time frame and really weren't able to do as much as we would like with that kind of study. So, American Red Cross is a well-known organization. It was chartered in 1905 by Congress. And their main focus is disaster services. If you notice, there's 4,000 volunteers listed in just the Chicagoland area alone, but only 650 of them have something to do with disaster services. Obviously, they've evolved over time, and they're doing a lot of other services for the community. But for our purposes, we studied the Disaster Services Division and the 1,200 responses they do every year for emergencies in this area. It's that, if you think about that, volunteers responding 3 or 4 times a day to assist victims of, in this case, residential fires. That's a lot. It's a lot to expect out of a volunteer organization. And Sarah's work with that, being a dispatcher to send these people out, she was seeing a lot of issues with that. Problems with getting verification of what the incident was. It was very frustrating for her personally to get people sent out. And when she came into this program at the end of last year, when we were trying to decide what our study was going to be, she identified this as being an issue that should be examined and why we cannot, or she could not get better information on how to send out these resources in an efficient manner, in a cohesive manner. Regional fire departments cannot be looked at as just one group and say, well, fire departments, it's all the same. It is certainly not the same. 400 fire departments spread across this area run the gamut from the 5,000 member Chicago Fire Department, very professional organization, the oldest organization in this area, the fire department. Probably one of the oldest in Illinois. And that ranges down to the smaller suburban departments, who are typically working with other agencies all the time. They're not addressing their needs by themselves. They call their neighbors to come assist them. Someone mentioned MAVIS earlier, mutual aid box alarm system. That is part of that system, how you call for resources. Then you go down to the smallest little rural fire departments. Some of the counties in the areas that Red Cross covers, the 10 counties in Illinois, are very small. And you can have community fire departments staffed by just citizens who come at the call of a pager going off. And certainly they have a little bit different approach to firefighting and emergency responses than what would be the Chicago Fire Department. They collectively respond to about 4,000 fire incidents a year. You notice there's a difference there. There's 4,000 residential fire responses, there's only 1,200 responses by the American Red Cross. We're going to delve into that here shortly. But that is only a small percentage of what the fire responses are in the area. And anymore now, we are seeing less and less fires and more of other types of emergencies that fire departments are asked to respond to. The city of Chicago alone, 500,000 responses a year. The vast majority of those are emergency medical responses and other types of rescue needs. And then you get into the structure fire issues. So the problem I alluded to a little bit is that the Red Cross is having a little bit of trouble getting to these responses. They have a goal of being on scene within 90 minutes of a residential fire. The reason for that is, they want to be able to get services to victims, certainly. But they want to be able to just make sure to get there and properly identify the victims whom you're in need, give them information, give them choices about what services they can be provided. The national standard is 2 hours, so here they're doing a little bit more than that. Their goal, they're setting a little bit higher goal to be there in 90 minutes. What we're finding when we are looking at the data that Sarah will discuss in a moment, there are relatively few of the requests for services the Red Cross came from fire departments. Most of them come from an incident page network, which is a volunteer-based group who just monitors and listens to scanners. And these people are sitting around listening, and they send out these little emails. Hey, there's a fire. Hey, there's a car accident. Hey, there's something happening. And the Red Cross is relying upon that as their source of information to send resources. Obviously, that's pretty unofficial. That's not the best way to get information. So that would put someone like Sarah, who's volunteering in the dispatch center, say, all right, well, now I have to call the official agency and get that proper information. That's hard at times. Who do you call? There are how many dispatch centers in the Chicagoland area? Some of them may or may not be helpful. They do not follow a standard dispatch protocol. They don't even follow the same technology. Everybody picks their own. Radio frequencies aren't common. And so if you go beyond that, say, well, I'll call the individual fire department. Well, if it's a volunteer fire department, there's probably nobody in the fire station. And some of the bigger fire departments don't care to talk to the Red Cross on the phone. So it's a really tough thing for them to get resources out in a good manner. I ain't covered all that, so we should have this sequence. I'll move on to the next part here with Sarah's talking about the qualitative or quantitative data.
Okay, yeah, so as Bill alluded to, there is an observed problem, but how do you define communications and how do you give it a quantitative number? So we were trying to figure this out, and one of the very first questions that we thought could start to get us an answer was how many fires are actually happening in the 10-county RQC region that they're just never finding out about. And so to do this, we got two different databases, a collection of data from the Red Cross, it was about 3,074 cases, and then a collection of data from the National Fire Incident Response Reporting System, NFIRS. And what that is all of the fire departments nationwide report every incident they go to, and that is collected and compiled through the U.S. Fire Administration. And they were able to send us data for their most recent years, which were 2010 and 2011. And when we got it, I think we had a collected total of a little over 4,500,000 cases, which we were able to whittle down to 8,000. 8,000 residential fires in the 10-county region that the American Red Cross of Greater Chicago responds to. And so we did a sampling comparing both of these two data sets, and we found that about 68% of the fires that are happening in the region, the Red Cross never even hears about. They're never even notified, let alone able to send responders. And so we started to look at that with a little bit more detail because the region that Red Cross deals with here in the Chicagoland area is incredibly diverse. Obviously there's the city of Chicago, which is its own monster, but you also have Grundy County, Kankakee County. These areas are incredibly rural and sparsely populated. And so we broke them down into community types. We looked at, are there differences between the city proper, the suburbs, and these rural communities? And we found out that in the city, 45% of fires are reported to the Red Cross. As you move further out into the suburbs, 25% are reported, and when you get into the rural areas, only about 17 to 18% of fires actually even make it to the Red Cross and allow them the opportunity to send out responders. The Red Cross, for a variety of reasons, sort of filters when they respond. Obviously, if the building is known to be vacant, they're not sending responders. They have a response rate of about 77%. So when they're notified, they're going about 3/4 of the time. But when you combine that with how infrequently they're notified, they're actually only ever going to 25% of the cases across the entire Chicagoland, Greater Chicago region, which is actually pretty indicative that they're missing. There's some critical information that the Red Cross is not getting. There's a couple of things that Bill alluded to that we also really looked at that we thought could be really interesting as far as this communications gap and defining it quantitatively, which with the notification times and the verification times, the Red Cross has to be notified of fire, and so we looked at the median amount of time it took from when the fire department gets the call until the Red Cross is notified. And we actually found out that overall that was only 23 minutes, which really seems pretty good. And in those instances, that 90% of the time where Red Cross is calling to verify those incident details, they're getting in touch with that jurisdictional fire department to try to make sure they're going to the right address, if there is actually a need there. That median time was about 8 minutes, again, which is pretty good. But again, when you start to look at that by community type, the notification time for the city and the suburbs, both about 23 minutes. Rural areas, about an hour it would take before anyone would even get in touch with the Red Cross and say we have a fire with potential displacement zones. And verification times, again, in the city it was about 4 minutes, in the suburbs about 15 minutes, and then when you go into the rural areas, it's about 45 minutes to get in touch with somebody and have them confirm for you that there's a fire, you do have the correct address, and there is a need.
So I'll talk about the qualitative data collection. So we actually had two sets. The data that she crunched and spent a ridiculous amount of time trying to get through and come up with useful numbers. And then we also did in-person or phone conferencing interviews to get a better feel for what was going on in the community and from the fire service side and through the Red Cross management's perspective. The fire chiefs were a statistical sample of all the fire chiefs area. Obviously, we were not going to talk to 400 of them. We didn't meet our goal number. It's very difficult. It's kind of like herding cats to get fire chiefs on the phone. I did my very best, but we did speak a pretty good sampling of them and a pretty good breadth of the types of fire departments. The one disadvantage that we did find later on is that the ones I spoke to were actually wealthier suburbs. Probably not the best sample in that regard because we'd rather like to see a good spread of less wealthy communities and higher ones. But I got what I got, so I did what I could with the information that we had. There was it was interesting to speak to them. There was mutual respect between the two different groups. The Red Cross and the fire departments all respect each other. They know each other's high-end goals and high-end responsibilities and advertised needs. When we pushed it that a little bit further, especially with the fire service, you would find that the fire chiefs had a good idea what was going on because they hear all this at the different meetings that the Red Cross goes to, but that never gets beyond the fire chief. It usually does not go down into the organization itself. And what the Red Cross has been doing up to this point, the best example I can give is the Red Cross will call on the phone and say, do you need our assistance? And the fire department's membership, the person on the scene, would look to the citizen and say, do you need their help? Without ever defining what help the Red Cross could provide. And that's something that's going to play into our recommendations here. There's a lot of things, another example of issues the fire department's brought up was the Red Cross would just come into the scene and just do what they wanted to do. Didn't communicate what they were doing. We're talking to victims, maybe even removing victims from the scene and not communicating well with the fire departments. Didn't have an understanding of the incident management system as being applied by the fire service. So certainly that's a friction point that we've identified for working with people out there. Another interesting point is that some of the communities provide the same services the Red Cross does at the basic level. I remember one community said that we pay for the hotel rooms for people who are displaced. I mean, the actual community pays for it, which is unusual. You don't normally see that. Some of the fire chiefs take, so there's that issue where the Red Cross may not be needed because the service is being provided at some level. Another issue is that some of the fire chiefs took a really possessive look at how they took care of their community. And the Red Cross, in their mind, was not coming full circle and giving them information about what they had done. So Red Cross would come in thinking that they are doing their job, and in fact are doing their job. But from the fire chief's perspective, it's like, yeah, but you're not part of my system, and you're not telling me what you're doing. So it was kind of a negative, perceived as a negative. And lastly, another example that was given was that in the 10 counties that the American Red Cross of Greater Chicago covers, in Illinois, and there's 3 in Indiana as well, it's perceived that Chicago is the biggest priority, the city of Chicago. Obviously, it has the biggest population center. And the example the one fire chief gave me was during the floods here a couple years ago. His community was severely damaged by it. He had 100 families he had to deal with and come up with ways to feed them, ways to house them, and he was calling on the Red Cross to help them. The Red Cross had no resources. They were already committed to the city of Chicago. So he perceived that as a negative and said, obviously the Red Cross is not there for me, and it doesn't deal with them, it doesn't call them as often as maybe he should. Interestingly enough, though, the local Red Cross volunteer who did come to the scene went and got the food and the supplies he needed on his own car. He had a card from the Red Cross, but he took care of that. So it wasn't Red Cross, the major, the office in Chicago handling it, but the individual took care of it. A member of the Red Cross took care of it, but the gentleman I was speaking to didn't view that as a positive. He thought that was a negative. So it's interesting how that plays into some of these relationships.
So recommendations. After we had all of this quantitative data and all these qualitative interviews, we had to sort of figure out what the commonalities were and address changes that we felt could be implemented to sort of alleviate some of this communications gap. And really, they kind of fall into a couple of simple categories. One is the idea of knowledge transfer, which is something that Bill alluded to, where we felt there's really effective communication between the higher levels of both of these agencies. A lot of administrative staff within the Red Cross goes to chief meetings and they talk with these fire chiefs on a fairly regular basis, but how much of that information is actually being transferred down into the rank and file so that boots on the ground, whether they're Red Cross responders or firemen, are familiar with each other's services and how each other do their jobs. And so 2 recommendations that really came out of increasing knowledge transfer from these organizations, is to sort of develop training for both the fire department side to really better understand comprehensively what the Red Cross can provide. And in short, what that is when Red Cross responds to these disasters, they will provide food, shelter, clothing, winter garments if applicable, and medication, prescription eyeglasses, things of that nature when it's needed for the first 48 hours after the disaster or the house fire. And conversely, there is a feeling, especially in the fire department side, that Red Cross personnel were not trained well enough in ICS protocol, and they weren't carrying themselves effectively on scene as far as checking in with the incident commander, letting their presence be known, and getting permission to approach a client before they were just sort of proactively doing that themselves. And typically that wouldn't be a problem, but if there is a potential arson investigation that would take place, having Red Cross impede before they are given permission from incident command could be a problem. So developing some sort of cross-training if possible. I mean, especially when it comes to ICS, having the fire department involved in running ARC-GC personnel through these ICS protocols would be incredibly helpful. And similarly, having fire department guys on the ground who know what the Red Cross does, so when they're talking to these clients, they can specifically say, this is what we know the Red Cross can offer, do you need that help, would be a lot more effective. We also, again, talking from the Red Cross specifically, their government operations capacity is basically one person. Is one guy who's trying to corral over 400 fire departments and maintain communications. And they have recently changed that. They've started to engage other staff members in government operations to try to expand that capacity and to be more involved, and they've become subject matter experts on a single county. There's one staff member who's assigned a county, and it's their job to really involve themselves in that county, familiarize themselves with that county and those fire departments, and become not just a Red Cross contact, but a name. And that really leads us to another idea, which is just trust. It's building trust. It's knowing that you can reach out to somebody at an organization who has a name, who has helped you in the past and who can help you going forward. And that's critically important when you're dealing with an organization that's over 550 volunteers. And so the odds that when you're on scene, you're getting the same volunteers, interacting with the same fire department staff, is really limited. And so having these people, these key people at these organizations who can talk to each other, who are interacting on a more regular basis, will start to develop that trust and hopefully improve communications between both the organizations. And alluding to something else Bill spoke on, another concept we looked at is the idea of knowledge sharing, which is sort of creating a knowledge loop between these organizations. When we looked at this, it was really one-sided. The Red Cross was in a position to need more information than it really necessarily had to offer the fire departments. And what we found out, speaking with that one fire chief specifically, who really just wanted to know what's happening to his constituents when the Red Cross shows up, here's a really great opportunity for Red Cross to start to pull that knowledge loop back around, because now they can compile a report, talk about the assistance they're able to provide, how this client is doing, what that long-term prognosis is, and really let those fire departments know what's happening to the people in their communities when they're calling in Red Cross, as opposed to just they calling Red Cross, the client served, and then they never hear of them ever again. And then lastly, another very Red Cross specific concept is, again, whenever we're calling to verify the fire, you ask, do you need Red Cross services? And again, that allows the fire departments to make that determination. Yes, we do, no, we don't. And so really, there's just a simple language change. Instead of asking, do you need services, can we send somebody? Can we come and look at the situation and determine if we can provide assistance? Which starts to allow the Red Cross to kind of take back some of that power, maybe get on scene more often, and make that determination about service needs themselves.
So lastly, areas of future research, for us, we did find that there wasn't enough time to do this very well. We would love to go on it a lot deeper, and everyone's turning it up. It's the same for you too. The biggest thing is that, she alluded to the changes that the Red Cross has already done with the individual assigned to each county. Is that having any effect? That should be studied to see if increasing those numbers or changing that dynamic would help this situation. One of the things we talked about is, we have this huge gap in number, this big number difference between the number of times they get called and the number of fires there actually are. But we don't really know if someone is actually a victim going without services. Nobody knows that. So that probably should be studied. We're assuming the Red Cross thinks we are the be-all and end-all, and we provide this service and we are needed. You might find out that actually the citizens are just fine. That the 1,200 responses they go to every year addresses the need properly, and we should look at that and see how big this problem actually is. We really started this thing out. If anyone remembers last year, we were talking about coming up with some type of technology to make it easier for someone to report or request Red Cross services. We started that way, and we never got there because it's far too much information to go through. So that should be investigated. Can we come up with an application for a phone to just say, I need this, and it gets sent right away? The same kind of thing as above. Once the recommendations that we've put forth are implemented, it should be studied to see if they're effective and adjust those. We shouldn't just assume that we know everything, even though we do. We shouldn't assume that. And actually and try and take a look at this and keep evaluating this process and not be a stagnant one-time report put on the shelf after it's implemented and left. The other thing we thought about is we should study other metropolitan areas. Obviously, the Red Cross is throughout the United States. Chicago is not even the biggest metropolitan area in the United States. Is this a Chicago-specific problem, an Illinois problem, is it a Midwestern problem, or is it common throughout? I think we'll find it will be common throughout the United States. It would be interesting to see, especially with a study, maybe there's best practices that can be brought together and applied. And one other issue is, the NFIRS database as collected, all the information is collected for fires, doesn't really address the victim's assistance component. It talks about injuries. It'll say if someone was killed. It'll say if someone was injured in a fire. But it doesn't say if someone was provided services, if they were displaced, or anything like that. And it would be very good to have that added. It'd be a nice collection of data. It might actually be really good for not only Red Cross operations, but a whole host of things like insurance company data and things like that. Have that centralized information coming in and being utilized nationwide. So with that, there's no questions. We'll be moving on.
You got a hand up?
I was just wondering whose responsibility it is to notify the Red Cross, or what the procedure is that's supposed to happen.
There's no assigned responsibility at this point. Right now, notifications come in from a variety of places. The clients themselves will sometimes call. Sometimes fire departments, police officers will definitely call. Social service agencies, we have a lot of phone calls from health and human services, things of that nature. But the IPN is definitely the most common notifier, which is this incident paging network that I spoke about.
Tim?
Is there any thought about having Red Cross dispatchers go and sit with fire department dispatchers when possible, to get that communication started?
There's been some recent collaboration between the Red Cross and OEMC, and right now, we didn't factor it into the study because the data we had from NFIRS that data was from prior. So after, I think about a year ago, they've actually been getting direct notifications now from OEMC. So as a dispatcher, we get email pages through OEMC when they get notified about a fire. So as far as coordinating and getting this all in one place, unlikely I would think, but there is some better collaboration.
The limitations of Chicago is 2.4 million people, but they're covering 9.6 million in the 10-county area. So there's a great deal more going on outside the city and population numbers. So it's hard to get what is, how many volunteer dispatchers are there? 30 people?
Yeah, 25, 30.
25, 30 people can volunteer to just be downtown doing dispatching, let alone get out and do dispatching.
I see a hand in the back, Mark?
You had mentioned about the one fire chief basically writing his city off as far as Red Cross response to the flooding in the larger metropolitan area. Did your research find a willingness or a lack of willingness at local levels with different groups to coordinate with the Red Cross? I mean, it just kind of seems like Red Cross is expected to do everything if they don't have a lower level in the community, like churches and houses of worship.
But they do work together. Red Cross has lots of collaborative relationships.
No, I know they have some, but was there a lack of that? Because I'm just thinking in that situation, you have your 4,000 volunteers, they're going into the city en masse, but you still have a group of people that are probably left in the community that are associated with a church, and maybe they don't want to be Red Cross volunteers, but they're XYZ church volunteers that the Red Cross can pick up the phone.
We talked about that, but one of the things I did not mention is that the Red Cross should do a study of what services are provided in each community, do a survey. Then they would know that, in this city, we don't need to provide that service, it's covered by a church group. Those things should be studied so that they wouldn't waste the effort. She wouldn't have to call to verify that service is needed because it's already been provided by someone else. So yeah, exactly. It should be known, it should be quantified and kept up to date.
Courtney? You your hand? I'm sorry, okay. Other questions? All right, I think our audience is finally winning it up. So thank you to our presenters and congratulations.